supervisors, staff, and guests. Put my mic on so you can hear me. Would you please push your ballot box for roll call? Okay. So we have 12. We have 19 present and 2 absent. So we have a majority. All right, moving on, please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. A motion to approve the agenda. All right. I have a motion by Supervisor Stillman and a second by Supervisor Booty. All right. And it's the second amended agenda. All right. Okay. All in favor of that, please vote your ballot. Scott, would you confirm, please? Thank you.
It times out.
There, okay. All right, we have 19 yes, 0 nay, 2 absent. We have a majority vote. You have the minutes in front of you. If there are no additions or corrections, I would ask for a motion to approve, and I have a motion by Supervisor Booty and a second by Supervisor Baraboo. Please vote your ballot. Supervisor Shu, would you please confirm? Thank you. 19 yes, 0 nay, 2 absent. We have a majority. Are there any petitions?
There are no petitions.
Any communications?
There are no communications.
Public participation. I don't believe there's anything signed in there. We have no guests. All right. Special business. Bonnie Kolbe, Health Officer, will do a presentation on public health.
Good evening, everyone. I will not try to take up too much of your time because I know there's a little bit of a game tonight, I think, if any of you are interested in watching it. So I'd like to start out by introducing myself. I'm Bonnie Kolbe. I'm the Health Officer here for Calumet County. I've been with Calumet County now. Is it okay? I've been with Calumet County now. In July, it was 34 years. I know I don't look that old, but 34 years I've been here. So it's been a long time, and we have a great staff, and that's what keeps me here. So I'm not going to talk tonight about COVID because you probably have had it up to here with COVID lately, and that's all we've been doing for the last year. I will touch on it very briefly. However, if you do have some questions, I might be able to answer a few here and there. But other than that, let's start out with what do we do? A lot of people say, what do we do in public health? What goes on in public health? So I'm going to start out with a quick 5-minute video that talks in general about public health. So hopefully I can get this to work.
Hello and welcome to this video where we're going to talk about public health. Public health has made a significant impact on the health of populations, making people healthy and saving lives. For example, in the United States, between 1900 to 1999, people's life expectancy has increased by over 30 years. Did you know that 25 of these extra years gained are due to public health interventions? So in this video, we're going to take a look at what public health is, how it's different to clinical medicine, who's responsible for doing it, and how it's done. First of all, let's have a look at what health is. The World Health Organization defines health as a state of complete physical, mental, and social well-being, rather than a mere absence of disease or infirmity. This is a pretty bold and ambitious definition that prompts people to look beyond diseases and focus not only on the physical aspect of health, but also on the mental and social aspects as well. And public health? Well, public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts of society. Okay, so how is it different to clinical medicine? Let's take a look at an example. Let's say someone has an accident and has a broken leg. A clinician's main focus is the immediate health problem, fixing the fractured leg. Clinicians focus on the individual. The public health approach would be holistic and would focus on figuring out how and why this person had an accident, so that actions can be taken to prevent it from happening again. For example, why did he have the accident? Was there a problem with his vision? Was it poor knowledge of driving skills or bad attitudes towards driving? Was he under the influence of alcohol or drugs when he was driving? Are there laws against this and resources to enforce it? What are the community expectations or attitudes towards driving? Does he have a good social support network that will help in his recovery or prevent this from happening again? Was the road he was driving on safe? Was he driving a safe car that was well maintained? If not, why not? Could he not afford it? If not, why could he not afford it? Does he have a job that doesn't pay well? Why is that? Is it because he did not have access to good education? Was there good access to health services which would determine his treatment and recovery? As you can see from this example, health is determined by a complex interaction between many different factors or determinants of health. These include individual characteristics, lifestyle and behaviors, and also the physical, social, and economic environments, the social determinants of health. In order to make a difference in health, there's action needed across all the different determinants. Public health focuses on these upstream factors to make changes that can benefit the health of the population as a whole. This seems like a very broad and complex task, doesn't it? So, who's responsible for public health? Ultimately, the responsibility of creating a healthy community rests with all sectors of society. Health departments do have a central role in public health. However, improving the health of a population requires the coordinated efforts of a broad range of stakeholders. This includes other areas of government, the private sector, non-governmental organizations, international organizations, and communities, to name a few, all united with a shared goal of improving the health of the public. Now let's have a look at how public health works. The World Federation of Public Health Associations has developed a useful framework to understand how public health is delivered. There are 3 core service areas of public health and a group of enablers that ensure that these services can occur effectively and efficiently. The 3 core areas of public health are protection, promotion, and prevention. Protection is about protecting the health of the population. This includes the control of infectious diseases, managing environmental hazards, ensuring a healthy workplace, and managing health emergencies. Promotion is about improving the health of the population. It covers a broad range of activities that not only focuses on the individual, like promoting health behaviors over a life course, it also focuses on improving the social determinants of health. Prevention is about preventing health issues before they occur. It includes activities such as vaccination and screening. To enable these core areas to function, there needs to be good governance, advocacy to influence and obtain support and commitment for actions that support a health goal, capacity, having an adequate, well-trained and supported public health workforce, and having accurate, timely information to support health actions such as relevant research, surveillance, monitoring, and evaluation. So that's a quick introduction to the fascinating field of public health. We've had a look at what it is, how it's different to clinical medicine, who's responsible for doing it, and how it's done.
Fascinating. That's the word you used. Okay, so really, let's start from the beginning here. What is public health in Calumet County? And really, this gives the definition of public health right here. We promote, we protect the health of the people in our community, along with overall public health protects the health of people in Wisconsin, in our state. We work to ensure that where people, in areas of people where people live, work, and play are safe and free from the environmental hazards. So as you saw in the video, and as you can see here, there's a lot more to public health than people really understand. We're usually the people in the background. We're the ones in the background, and as long as things are going along smoothly, you really don't hear a lot about public health until that big P word hits and called a pandemic. But we'll talk a little bit more about that later. So then we go on to what governs public health. We have different areas that govern public health. On our state level, we have the state statutes. I'm not going to go through every state statute, but they're in 250 to 255. If you ever want to have some interesting reading, you can read about it. 252 really is one of the basic statutes that we follow because it deals with communicable disease, which is a lot of what public health is about, is trying to prevent the spread of communicable disease. 254 is an area where I come in a lot because it deals more with the human health hazard piece, the environmental health piece. And like I said, you can read about these things at your leisure at some other time. There's also Wisconsin administrative rules, and I listed some of those that affect public health here. Again, you can read about these at a later point. I do not have to go over all of those with you. But there's a lot of rules that govern public health. In addition to the state statutes, the administrative rules, we have other rules. We've got OSHA that covers some of public health. Federal guidelines, CDC guidelines, any guidelines that are out there, DHS, Wisconsin DHS guidelines. And, we are part of a county structure. So we have our administration too on the county level. We have the county board. So we have so many different levels that we have to follow the rules by. Those are just some of those rules. So, as I said, I'm the health officer for Calumet County. These are the local health officer requirements by state rules. So you can read over those, but really it's more managing the public health program here in each jurisdiction. And these are the things that I do have access to and that I do have responsibility for here in Calumet County. Any questions on that? If you have questions in between, don't hesitate to ask. I can't promise you answers, but I'll try. So every local health department has to meet minimum standards, and that is the level 1 health department. These are the minimum standards for a local health department. We have to provide communicable disease surveillance, like I talked about, generalized public health nursing program, health promotion, disease prevention, and human health hazard prevention and control. Plus, a local public health agency has to have a full-time health officer and a board of health to govern us. Those are the basic services required under a level 1. Then there's the level 2 health department. Calumet County, we are a level 2 health department. There are 3 different levels of health departments. I will not even talk about level 3 because that's beyond what Calumet County is doing. But we are under a level 2 health department, which is a step up from level 1. And with that step up from level 1, usually the funding follows. So if you're a level 1 basic health department, which there are a lot of departments in our state that are level 1, they get the lowest level of funding allocated to them based on some type of formula that changes all the time. But they get the basic level. We are a level 2 health department, so we get the medium level. Level 3 health departments, City of Appleton, Outagamie County, Winnebago County, they are level 3. They actually have a separate environmental environmental health program. They do weights and measures. They inspect, they do sanitarian duties. They inspect pools, restaurants, all of those things. We do not do that. Our state does that for us on this level. So under level 2, we have to meet those bare minimum requirements, the level 1 requirements, and we have to additionally provide 7 programs or services that address at least 5 priorities in our current state health plan. So every 10 years, our state has a health plan. You know, healthiest Wisconsin 2020 is the most recent one. And we need to address any of the priorities in that health plan. At least 5 of those we have to address. You have to have a health officer with at least 3 years of supervisory experience in a full-time position within a local health department. And you have to, and the determination for if you meet that level status is made by the Division of Public Health, the State Division of Public Health, and they come and assess us every 4 to 5 years to determine if we're meeting all of those qualifications. So you'll know when it's that time. They'll tell us they're coming maybe in 6 months, and we have to gather tons of evidence to show that we are meeting the requirements that they set out for us as a level 2 health department. Then they come in. I don't know if any of you have ever participated. I know Jim Stecker, who used to be on the board, he participated in that the last time we had our health assessment. So I think we're probably going to be due in a couple of years for another level 2 health department. And you're welcome to join us if you want to hear the state, what they have to say about our health department. To be honest, in the last process, they were very complimentary of how we provide services in Calumet County. We're not a really big county, but we provide really good overall services and meet those essential services for Calumet County. So one of the areas that our state and our nation is really big on right now is accreditation for public health. There are a lot of requirements to become an accredited public health agency, and they keep promising us that funding is going to be attached to accreditation. However, if you want to become fully FAB or Public Health Accreditation Board accredited, there's a fee, and it's very high, especially the initial fee. And I cannot remember what that fee is, but it's in the thousands and thousands of dollars to become accredited. And there's a lot of work involved in becoming accredited. So what we've been working towards at this time, you know, maybe at some point we will consider accreditation, especially if a lot of funding is tied to it. But at this time, what we have been doing is working on, well, 2020 was an off year. We didn't do a lot with this, unfortunately, because of that pandemic. That was a big part of our lives. But we've been working on accreditation readiness. And that includes things such as setting up a strategic plan. We do have a strategic plan. I don't know if the board has seen that. Have they seen that at all, Todd? Okay. Okay, but we do have a strategic plan that we'd be welcome, you know, we'd love to share with you if you'd like to see that. We also work on any quality improvement projects, so I'm trying to think of some of the projects we have worked with. Trying to get children immunized on a timely basis. You know, our rates are too low, we want to get them up higher, so we do a quality improvement project to increase those rates, and then, you know, plan, do, study, act, we revisit it. So we're always working on improving ourselves to help our community. Workforce development is another area that we look at, and we try to provide those educational opportunities for our staff so that they can become better at their jobs. They have more knowledge in regards to their jobs. We want people to become certified and accredited because it just helps them do a better job to help our community. And we have to assess the health of our community. As a part of public health, we have to do that anyway, but it's the continual assessment of the health of our community. So one of the program areas that we have that I talked about earlier is communicable disease investigation and follow-up. That is a core part of public health. Anywhere you go, Everybody needs to be doing that communicable disease follow-up. We get reports on various communicable diseases, and there's different levels of communicable diseases that we need to follow up on. I just gave some examples. There's lists of communicable diseases, but these are some examples of some of the communicable diseases we have to follow up on. And of course, the biggie is COVID-19, and that has captured a lot of our time in the last year and a half. But it is something really important we need to follow up on and continually follow up on. The pandemic is not over. We still are, unfortunately, we're starting to see a little slip up in cases again, and I think nationwide we're seeing a big increase in cases, and we've got the Delta variant, which is very contagious. Kathy said to me today, she said, whereas the normal variant of the virus, you know, if one person had it, they could infect probably 1 to 2 people typically. The Delta variant, you're looking at that being 1,000 times more virulent. And because of that, she said typically it's like 8 or 9 people can become contagious from it because it's so strong and virulent. So it's something we're looking at and thinking about, and, you know, what do we need to do in our community? What do we need to do to get the word out? Education is a big part of public health. Here are some other diseases that we put on here. You may have not even heard of some of these. In fact, before I got into public health, I'm like, well, they're starting talking about campy. I'm like, what is campy? You know? But you know, it's listed here, campylobacteriosis. That was something I never even heard of before until I started in public health. And it's a bacteria, causes diarrhea. I mean, and we do get cases of it, you know. There's sexually transmitted diseases. We do get cases of it. Chlamydia is the biggest one that we seem to have a lot of cases of. And we need to look at that and say, you know, what do we need to do to try to prevent this in our community? A lot of our work is prevention and education. We're always in that background. We have another program called Baby Bumps, which is really our prenatal care coordination. It's really meant to help the pregnant women, giving them education, getting the health care that they need, because some people don't know how to navigate through the healthcare system. If, you know, some women are just like on their own, or they don't understand how to navigate through the system, and we help them find assistance in their community to get those resources that they need, so that the ultimate outcome is that they have a healthy baby and that they stay healthy too. We also can refer them to programs like First Breath and My Baby and Me, which are both state programs that we've been trained on. Oh. I'm not seeing, I've seen immunizations now. It's not in my packet. Did I skip immunization before that? It slipped. Oh, you know why? It's on the back page. Got to follow the back page. So, immunization, sorry, I skipped a page. Thank you for telling me that, Todd. So, yeah, very important. We provide immunizations. However, several years ago, our government decided that VFC, which is Vaccine for Children, that they provide for children in our communities, that if people are insured and can get their vaccines at their healthcare provider under their insurance, that's where they need to go to get their vaccines. So that has been the shift in that respect. Unfortunately, what we're seeing now is where we saw our 2-year-olds were pretty much up to date on their vaccines. Our vaccination rate used to be really high, like around 90% or something like that. We just got our data for Calumet for our jurisdiction, and it's pretty low. I'd be guessing, I think it's in the around 70% or something like that. It's a lot lower than it had been. And I think sometimes the pandemic had a lot to do with that. People weren't going into their healthcare provider and getting their vaccines. So our work now is to try to make sure people get caught up on that. We can't necessarily provide that vaccine, but we can hook them up with their healthcare provider and remind them that they need to do that, and bring them up to date with what vaccines that they need to be compliant with our law. If people are underinsured, or have insurance that doesn't cover it, or they have Medicaid, something like that, then we can provide those vaccines. And of course, we are a COVID vaccine provider, and that we can give to anybody who's eligible for the vaccine. So I talked about baby bumps already. I know that. Then we also have our child passenger safety program, our car seat program. We have 2 staff that are certified child passenger safety technicians, a public health nurse and our public health educator. Before COVID, they were going into cars and helping people install their car seats, putting them in properly, teaching families this is how your car seat needs to be put in for the safety of that baby, giving them a lot of education. And I know firsthand it was great when with my grandchild, they helped me put one in my vehicle at one time. I'm like, oh, I didn't know that. Oh, I didn't realize that. Or the car seat's not fitting right. Sometimes they use a little pool noodle piece of it and they stick it in there in the back of it, whatever works to get the car seat to fit correctly in your car. So it's really a good program. We also purchase car seats. Thank you, Todd. We also purchase car seats to help those that cannot afford to have a car seat, because we'd rather have children following the law, being in a safe seat, versus not having them in an effective car seat. Some people try to borrow them, and they might be really outdated. Because car seats become outdated because they wear down and become outdated. So it's really important that they have a safe car seat. First Breath, like I mentioned before, that is a state program. However, our nurses are trained on First Breath as far as doing the screening and referring to the state. So that is still an important piece that we provide for Calumet County. It's interesting when you have the state come and teach you a lot of this information. It's like, oh, I didn't know that. So we've learned a lot from the state in regards to that. Then we have My Baby and Me, which is the other program I referred to, which is about alcohol use during pregnancy. Our staff is trained on screening and looking at individuals that might have issues with alcohol during pregnancy. And perhaps they need additional support. They might have been partiers, and now it's like, oh my gosh, I can't do it without my cocktail, or whatever it might be. And we want, our ultimate outcome is to have a healthy baby, because healthier babies lead to healthier adults, and it's better for our overall society. It costs a lot to take care of somebody who might have fetal alcohol syndrome or something like that. So all about that prevention piece. The Safe Sleep program is an additional program that our nurses have been trained on. And we use brochures, other media to teach families of newborns how to position their child in their crib and what type of crib to have, and all of the details of safe sleep. Things when my babies were little, I really didn't think a lot about. You had one position you put them in, and you didn't really think a lot about it. But our goal is to prevent SIDS, the son and infant death syndrome, and make it safe for the babies. And they've shown with evidence, it's all evidence-based, that using safe sleep strategies has really helped. Smart Start, it used to be called Bright Futures. We work with Human Services on this program. We make contacts to all families of newborns, and there are some families, families that need a little further follow-up and education. They might not have a really high educational level. They may be struggling with all kinds of family dynamic issues, whatever it might be. So our public health nurses need to go into those homes and really provide one-on-one guidance to them, hook them up with resources they need, provide them with some parenting skills. And we work with Human Services in that area also, so that we're working as a team, a social worker and a nurse working together to help these families. And it's wonderful to see the outcomes, the progression in a family. And again, it's less costly than having a family dynamics go crazy, and then you get law enforcement involved or something like that. So we want to try a little bit more prevention and make things better for those families. Oral health is another program that we are involved with. We used to provide fluoride samples to kids in schools, but they stopped that program. They said, they're thinking that it's better to educate and to get water fluoridated in the public water system, or dentists are constantly, prescribing fluoride, whatever it might be. But we still we test the water on families of newborns, the well water. We test the water, we send the water in for testing. We work with our planning and zoning department, we get that water tested and make sure it's free from bacteria and make sure it's got a high enough level of fluoride, whatever it might be. So we're always working on oral health and concerns with that. Environmental health. Okay. So areas that we deal with are dog bites, bat bites. We have had, in the last week, we have had 3 bats brought in, bat specimens brought in. Actually, one was brought in, I think, today, that we send in to the state lab and test for rabies. You have to have a part of the brain there for them to test for rabies. Last week, we had a case that was positive. And so then the family, because a family was involved, unfortunately, they all have to go in and get the series of rabies vaccines. The rabies vaccines are costly, thousands and thousands of dollars, and the vaccine is painful, to be honest with you, especially for little ones that have to get like 5 shots because you have to do it in all different locations. It's not a pleasant thing. So, unfortunately, it's better though than having rabies, than getting ill. I mean, I always think of that. What's her name? Jenna Gazy, whatever her name was, and I think of that and how she survived, which was amazing. But not a lot of people survive that, and that's why we test it and we provide that education and we get them in. We have to hook them up. It's really a complicated process because they don't keep that medication on hand, that vaccine, they don't keep that on hand. So they have to get it from a central location, and the sooner you got to get it in soon, quickly, and it's a big, our public health nurses work really hard to make sure that the people can get that vaccine as quickly as possible. But we follow up on lead, Lyme disease, radon. We work with Manitowoc County in the follow-up on that. They do the radon testing for us if we refer it to them. And then, of course, West Nile virus. We right now we're not collecting birds for West Nile virus to test because we had enough cases of it. But every year they tell us, okay, start collecting birds, and then we let the public know we need to. I think it's blackbirds. It's certain types of birds that we ask them to. People to bring in, and then we send it in for sampling. Medication disposal. We work with sorting out, the Sheriff's Department has, in their department, they have a med drop box. Are all of you aware of that? Because it's a great resource here in our community. People can bring in their expired, unused, whatever it is, medications, drop them off in that drop box. It's better than putting it in the dump or putting it in down the toilet or whatever it might be, because that's contaminating your water systems. They bring it in, and we're trying to educate people where it's located, how to do it. Don't dump it just in your garbage or whatever it might be. And then, I don't know if it's quarterly or it's 2 times a year, whatever it is. We work with UW Extension and we work with law enforcement to sort through the medications and discard medications. There's certain things, sometimes you get garbage in there, sometimes you get meds that are a little shady. So we want to make sure that it's safe and how we dispose of it, and so our public health nurses work on that process. Ken, here's your answer. Sharps Disposal Station. We are a Sharps Disposal Station here in Calumet County, which is really for the safety of the people in our community also, so people aren't throwing their used insulin needles, whatever it might be, just into the general garbage. So people can bring in their used needles. Hopefully they're in a strong container, hopefully a Sharps container, which is the red box, and bring them in, and we contract out with a company to dispose of them. In addition to that, we provide people with an exchange container. Here you go, here's another Sharps container to use for your diabetic syringes, whatever it might be. It's a great program. I don't know if everybody's aware of it, but we're trying to make sure the public is aware of it. Don't throw them in the garbage. Don't throw your syringes there, because inevitably they'll end up on, I always picture the beach with the syringes on the beach. Somewhere they will end up. So it's the best way to do it is to dispose of them properly. TB skin testing we provide. There's a fee for that service, but it's not a real large fee, and it's based on our administrative costs. That's all it is based on. We do the skin test and then read it 48 hours to 72 hours later. A lot of people that are working in the healthcare field, they need to have a TB skin test prior to doing that. So they contact us, they come up, we administer the TB skin test, and then have them come back and read it in the time frame. Now, if it's a positive, if if it shows a wheel, what they call, then we consult with the physician, and then the physician's office follows up and determines what needs to be done for that person. So we've trained our support staff actually to read, but if it's questionable, they will contact one of our nurses to do the follow-up on that. Another program is Grapevine, which is really, that falls hand in hand with community education. It's a program through Wisconsin Women's Health Foundation. It trains public health nurses to lead health education sessions in the community. Deb Wagner and Connie Schaefer, who's now retired, they both went to this training on the state level, and they learned a lot, and it was amazing how much they learned and are able to educate the community on certain subjects, certain programs. They've done presentations on brain health, they've done presentations on bone health, nutrition. And when I hear them talking and educating, it's like, wow, this is really good information for the public. So they really, it's kind of fun. It's a fun way to do public health. And then, of course, the continued health education presentations in our community, especially to our youth. We've done things such as hand washing for 8 to 12-year-olds. It's really fun because they do something where they put a special solution on your hands, and then you got to go wash your hands, and you come back and they put it under the light, the UV light, and you can see where things were missed, and it gives them a aha, oh, I missed that. So kids are kind of fun to show that to. There's also we go into the schools, we do growth and development for 4th through 6th graders. Kathy, our preparedness coordinator, she's done some personal emergency preparedness presentations, and then some healthy cooking demonstrations working with ADRC. It's great to have those community partners to work with too. And then we have our public health emergency preparedness. Like I said, Kathy Ellis is our FEP coordinator. And the focus on that, we get actually extra additional funding under public health for emergency preparedness. And it's really to prepare ourselves for any specifically bioterrorism-related diseases, illness, COVID, preparing ourselves for those types of things. And we are part of the Fox Valley Healthcare Emergency Readiness Coalition, Fox Valley HERC, which has a coordinator who is a nurse, and we have weekly meetings, monthly meetings, different meetings with the area healthcare providers, hospital systems, and we work together to continually improve on what we're going to do in case of a public health emergency. We have to do exercise drills. And we have to do calling tree drills. We have a calling tree set up, and every once in a while, a couple times a year, I need to randomly just start our calling tree. And I just call the top 2 or 3 people that I have to call, and then they have to follow through and call, like telephone. But it really is a good way to prepare. If there's an emergency, this is who we need to call, and then we find out how can we improve on that. So we work on that together. And human health hazard control and follow-up. Some of you may have heard of that. I may have talked about this at one time. I'm the health officer. As health officer for the county, most health officers have the responsibility for human health hazard control. Some have the environmental health section, and then they have their sanitarians go out on some of these visits to inspect homes. The picture that I have up there, 2 of those pictures are real pictures that I actually have seen and have gone out on. Knock on wood, if I can find some really good wood. I haven't had to do a human health hazard inspection for a while. I'm not looking forward. Every time I get a call, I cringe. Most of the calls, though, I receive are landlord-tenant issues, and I try to resolve that just via phone. I call the landlord and I say, hey, I have one right now. Hey, the ceiling tiles in this lady's apartment, I've got pictures here. They're falling apart. It's really not safe for her. It's probably going to fall on her head. You know, obviously there's moisture up there. Can you do something about it? Working with that landlord instead of me creating orders. If I don't have to do orders, I'd rather not do orders, because sometimes it just works better just to have the conversation and say, hey, let's do this. Sometimes I have to do orders, and by statute I can do orders. I work with Kimberly to create the abatement order, and she's always good at looking through what I write and correcting it, which is great. And then that way, I send out the orders, and I don't think I've, knock on wood, but I don't think I've ever had somebody who is not cooperative with cleaning up the human health hazard. One time we had one in the town of Harrison, and that was a long, drawn-out process. The house ended up being demolished by the village or town, whatever it is now. Oh, and the trailer. We had the trailer issue. Yeah, we've had some fun ones. Yeah, the trailer had to be moved out of the trailer park. Yeah, that was when I ended up with all kinds of little bites all over me. Yeah, it's not the fun part of my job. Ask Todd. I'll give it to anybody. Anybody wants to do it or go with me, you're welcome to come with me on those visits. I sometimes involve the sheriff's department too, because sometimes I go into situations where I'm concerned about who is living at that property, and I'm a little nervous about it. I sometimes have a social worker go with me also, especially if there are children involved or elder neglect is involved. So it's those partnerships on our local level. Then we always have to do a community needs assessment, a health assessment, a CHA in our community, and a health improvement plan, a CHIP. So there's a lot of acronyms and abbreviations in public health. We are required to assess our community on an ongoing basis. And we have a CHIP steering committee. On our local, on the regional level, we have our Fox Valley Community Health Improvement Coalition. It's a larger group of people that we get together, and we're trying to work on assessing the needs of the community. And that's called the Fox Valley CHIC. FVCHIC, and locally we have the Healthiest Calumet County Steering Committee. Some of you are members on that committee. We haven't met in a long time. 2020, COVID really took precedence. We will need to get back into that, when things start to really settle down with COVID, and look at our community and what do we need to do. We broke that down into different things that we need to work on in our community. One is alcohol use, which is our REACH program, and the other is health and nutrition, our problem with obesity in our community. We have our WIC program. Some of you may know, Women, Infant, Children, what our WIC program is about. It's more about nutrition. We just hired a new WIC director. Jennifer Cole, our WIC director, retired. So Clara Cohen has been hired. She's been wonderful. She's learning very quickly what she needs to do. She just told me today she became a certified breastfeeding consultant or something. I don't know. It's some test she had to take today. So, she's moving along in the process really well. This is an income-based program. It's for the moms and their children, or families and their children, to come in, and sometimes they get the WIC cards to get food from various grocery stores, and it has to be on the list, the WIC list. They can't just go and get booze or whatever they want to get. It has to be something nutritious that's on the list. And at some point we can have Clara probably talk to you about that program a lot more down the road. And we have our student nursing program. We have for a long time worked with UW-Oshkosh, my alma mater, to mentor senior nursing students. And we work with students on projects. They have to have a project each semester. So they develop a project and they give a presentation to us on their project. And we've used some of those as a part of our whole community health process. And then we also serve as preceptors for other nursing students, BSN completion students, and we do one-on-one public health nursing mentoring for those nurses. And regional communicable disease, sorry about that on my slide. Some of my words got cut off because my picture took the place, which I thought the picture was cute. So on my real slide, it's not there. But we just basically are meeting with the healthcare system in our region and talking about how can we make improvements to reporting of communicable disease and, following up on communicable disease. You didn't think public health had all this stuff to it, did you? So we have Community Action for Healthy Living, which is based in the offices in Kaukauna. It's a Outagamie County, Calumet County initiative. We work on healthier lifestyles within our communities. It started out as Community Action for Tobacco-Free Living, and once our state became more of a tobacco-free state, the focus has shifted, and along with, we still do tobacco-related activities, especially with vaping and chewing tobacco and candy products that are, hooking people and things like that. We also work with our DFC grant, which is Drug-Free Communities. Calumet County applied for this 5-year federal grant, hired, and that goes into our REACH information down below here. We hired a coordinator, Annie Von Newpert, and we hired a youth coordinator through Cahill. They're the fiscal agent, and they are doing activities around reducing excessive alcohol consumption, especially for youth. We have various community partners that are on the steering committee for that. We have law enforcement at the table, very good partners at the table. We have human services at the table. We have schools, various partners at the table working together to, Calumet County is not a proud statistic, but we are #1 in our state for the highest rate of binge drinking in our state. So we don't want to be #1 in that area. We want to be #1 in other areas, not that area. Even though we're the cocktail center of the world, I don't know. But we really, and our focus really is on youth more than anything. Some other programs, Safe Kids. We work in the Fox Valley with the Safe Kids program, which is more about vehicle, home safety, recreational safety. First 5 Fox Valley, that's a child resource and referral. If people are looking for childcare, it's helping with that, helping hook people up to that, those services. And NEWIC, which is the Northeastern Wisconsin Immunization Coalition. And that, there's actually a physician on that committee, and they are trying to work on getting kids immunized on a regular schedule. Sorry, I'm going as fast as I can here. There's just a lot of programs involved. We've got UCAN, which is our Activity Nutrition Coalition, and some of you may have been part of that. Of course, the goal is, for our citizens to be healthier. We want to see a reduction in weight. We want to see people being more active, so healthy eating and becoming more active. And again, that we haven't met in a long time because of COVID. I'm always using the excuse of COVID, but it is the truth. But we have to get back to that coalition. We work with Be Well Fox. I think it's called Be Well Fox Valley, which used to be Way to the Fox Valley. We work with them on the regional level. Theta Care has taken a lot of that program over. And we're working on different events to make people healthier in our community. Mental health. Our public health nurses have gone to some of the Northeastern Wisconsin Mental Health Connection meetings. There's the Zero Suicide Initiative coalition that one of our public health nurses, Wanda, has been a part of. And there's also a Calumet County Mental Health Collaborative, which they haven't met for a while, again, probably because of COVID, but the committee has been formed to work on getting mental health counseling into our schools in the upcoming school year. Because we're about all different kinds of health. And then our state organizations for public health, WALDAB, Wisconsin Association of Local Health Departments and Boards. Mary had been a president of WALDAB, but she's a past president now, I think is what your title is now, past president. That's our voice on the state level for public health. We are still in our region, or actually in our state, they're still looking for a co-president-elect Board of Health. So any Board of Health members in this room, if they're interested, see me. And looking for a Northeastern Region Board of Health representative. So it's someone that is on the board as a regional representative. Mary?
I am. Not
You-
anymore. I am the rep.
You are a rep now? Because you know what? On their website, it does not say that. It still says no. So Mary is our rep on there. You really learn, it's interesting, when I first started out in public health, I learned so much from being on the board. I was a regional rep also. And I'm like, wow, you learn so much more about public health. It's just so much more global than we really understand. WPHA, Wisconsin Public Health Association, we're also members of that. That is a broader public health. That's not just local health departments. It's broader than that. And there's information on that on here. And I get to the best part here. Questions?
Are there any questions of Bonnie? Yes, Supervisor Gleckner.
Thank you, Madam Chairman. I was just thinking that we all know that Flint, Michigan is not the only city in the country that has problems with lead pipes. And, you know, the average citizen or supervisor has no idea, you know, what the age of these pipes are or what they're made of and what the potential issues are. So are you able to, or do you already get involved with, say, the city of Chilton or Brillion or whatever, you know, Menasha, to follow up on the age of their pipes and whether they have lead contamination or not, so we can do something? Because we now are talking about infrastructure, there might be an opportunity to tackle something bigger.
We haven't, because we don't have a really robust environmental health program. We do lead testing, especially through our WIC program, and we follow up on high blood lead levels and do the education in regards to that, and especially with homes before 1950, things like that. We do that follow-up. Not the lead pipe issue. I do know that there is a project that our state is just starting with on lead. And I don't know if it's healthy homes or lead pipes, what it is. I just got information on it the other day. But again, that's more of a state lead. And I think the state deals a lot more with that than we do on the local level. But it's a good thing to think about and consider. Yeah.
At some later time, could you steer me to the proper state agency?
Sure.
Because I'd like to investigate
Absolutely.
that for my constituents.
Absolutely.
Thank you.
Supervisor Draheim.
Thank you, Madam Chairman. New Holstein has got a 2-year program right now going on to get rid of lead pipes. We're finding out that half the city almost has got lead pipes from the older section. All the other ones are okay. So that's starting, in fact. They got money from, I don't know who, the state or whatever, and the DNR, and so they started on this. And we should be starting on digging some up this year yet, and then next year is another. Hopefully we got some more money. So just to help you out. Thank you.
Yes, I'd just like to report also that the city of Chilton has a program going as well.
That's great to hear.
Supervisor Schwallenberg.
I think Hilbert is doing something too. I think his pipes have got to be replaced. They're looking at whether they're lead or not too. I'd like to compliment you on your presentation, and I hope what you said to everybody about that you're aware of what public health does, all the things that public health does, other than just taking care of COVID and immunizations. Everybody just think that's all it is. There are a few things I even learned here tonight too, and thank you for the presentation, Bonnie.
Thanks.
Anyone else? Okay, thank you, Bonnie.
All right.
Appreciate it. All right, moving on,
Oh,
Matt,
boss.
Business System Analyst and Communication Manager will provide an update on our redistricting. which is coming sooner than you think.
Good evening. I handed out a chart, a timeline process for everyone. Did everyone get that? We didn't miss anyone. Okay, you're good. I had updated the board last month on the process, and at that time, we had hoped that the governor would go through the process and sign a bill that was designed to delay the redistricting process. A little over a week ago, he did have the opportunity to look at the bill, and he did veto it. So we had hoped for some legislative clarity. With that veto, there is no clarity. So really what we have to do is look at, can we get this done? Normally, in a normal year, and I explained this last month, we would have received census data on April 1st. We would have been working on our tentative supervisory district plan, and you would have reviewed that months ago, well, probably in May. We're not going to get that data now scheduled till the release is August 23rd. So we can't do anything till we have the data. So looking at your chart, if you look on the left-hand side, you'll see the first blue box, July 28th to August 13th. This is a proposed timeline how we can get from today to December 31st and get redistricting done by that time. So districts exist and nomination papers for existing or new districts can be pulled to run for the spring election of 2022. So the first blue box, July 28th through August 13th, there would be 3 public informational meetings here at the courthouse. One on July 28th from 1:30 to 2:30 p.m., one on August 5th from 6:30 to 7:30 p.m., and one on August 13th from 8:30 to 9:30 a.m. Those meetings would go over the redistricting process, do a public education so the citizens know the process statutorily and the process that we're in now, that there's been a delay, and also ask for input in that process. Moving to the right, on August 23rd, we anticipate that we will receive the census data and be able to begin mapping new districts. We have to have that data before we can create the new districts, and that's based off the 2020 census. Also on the same date, we would publish a public hearing notice, a Class 3 notice in the paper. For the adoption of the tentative supervisory district plan and the final supervisory district plan, you need a 3-week public notice in a newspaper. So we'll be publishing notices for meetings nearly a month away, not actually having that product ready. But what we're publishing is the meeting, not necessarily the product. The product will be reviewed at that meeting, and it'll be available sometime in between that notice and the meeting to the public. Moving along to August 24th, we would anticipate taking the data and the information received from those 3 public informational meetings, and the county board would take action on the tentative plan, or not the tentative plan, the number of districts that you would like to see in your plan for the next redistricting process, and take action on the board size. So if you want to stay at 21 supervisors, if you want to move up or down. Once we have that information on the 24th, we can begin drafting the tentative supervisory district plan. So in essence, let's say a community or a county has 400 people. If the county board wants 10 supervisors, there would be 40 people per district. So we want to always have a substantially equal population in each district. So we need to know the number of districts before we can begin mapping. Moving on to September 21st, which is approximately a week later, we would begin that draft. We would have it done by September 21st. A month later, the county board would hold a public hearing, review that, and adopt a tentative plan. On that same day or immediately thereafter, once that tentative plan is approved, we would send that to all the towns, cities, and villages within Calumet County, so they can begin to create and adjust wards. So we would create puzzles, let's say 21 districts, if you stayed at 21 puzzles, or pieces of the puzzle, they would create pieces inside that puzzle as wards. So we would give them approximately a month to get that work done and get it back to us for review. So we would want that back by October 25th. That would give us time to review all the information within the ward plan, verify it's right and they fit within our districts, and then it would come to the county board on November 16th, which would review and hopefully adopt the final plan. Then moving to November 18th, Beth could publish a type A notice, election notice, which is required by state law. And on December 1st, nomination papers would be available to supervisors and citizens that want to run for the newly created districts. That is the time frame and how we can get this done by December 1st. Very compressed, aggressive, but with the governor's veto, we don't really have an option. I don't know, some of you might have been on the WCA call at 11 a.m. on Monday, and the legal counsel and kind of went over the same timeline on how we can get this done by December 1st. So with that, a couple of things I will bring up. I am concerned about the municipalities of Kiel, Menasha, and Appleton as they cross county lines. I have spoken with Jamie Aulick, the administrator from Kiel, and he would be good with this timeline. He can make it work. Beth and I have a meeting with the city of Appleton, city of Menasha, Winnebago County, and Outagamie County on Thursday to go over this timeline. So if we can all kind of be meshed in the same strategy on how to attack the municipalities that cross county lines, will be better prepared to address their issues as well. So that meeting's on Thursday. And from there, what we would offer to some of the towns and smaller units of government within the county, we would offer assistance in developing ward maps. So we would hopefully, in the next couple of weeks, if we're moving forward with this, to meet with the towns and the smaller villages and cities, get everyone together, show them this timeline so they could fit. They also have notice requirements that they need to be cognitive, and meeting requirements. They very well might have to have special meetings as well to make this happen. So there's a lot of moving parts and pieces to this, but this is a timeline how we can get from point A to point B.
Supervisor Booty, you had a question?
Yes, thank you, Matt. Now, as I recall from the meeting yesterday, the LTSB said that they thought the transmittal of data to the counties might be delayed or happen on September 1st.
Mm-hmm.
Now, obviously, that changes the timeline again. Would we, as a county board, I mean, I suppose we could take action on board size even without this data available. We just sit on that until we actually get the real data. Is that right?
Correct. And Zach Robinson, he was on the call. I had personally talked to him last week. He had stated that they would receive the data August 16th, post-process it for a few days to post-process it, enter it into the WiseLR software, and it would be available the 23rd. So that's why I have this date in. So I'm hoping on that. That was a direct contact, and I don't know why he didn't say that yesterday. Maybe he doesn't want to paint himself in a corner.
Okay.
I don't know if I just did here publicly, but.
I guess the other thing is, I know, when we redistrict, one of our often goals is not to try to eliminate a county board supervisor's position through redistricting. So, I mean, I know it's going to be August, way in advance of the next election, but obviously if anyone knows they're not going to be around, if they could make that, make that known to you at least, so that when you're drawing those lines, you can consider that. It'd be really helpful. And likewise, if we're going to make a change on the number, potentially if we reduce it, I guess it doesn't matter if we enlarge the size of the county board, but if we're going to reduce the size of the county board, that would also be a real beneficial if someone knows that they're not going to be serving next term on there. But thank you very much, Matt, for this update.
You're welcome.
Supervisor Cohen?
Thank you, Madam Chair. I know this is a tentative plan, but is this a plan that we may share with constituents? Like, can we share this information with people in our district?
Yes.
Okay, just wanted to make sure before telling
Yes,
people.
it's out here. It's public. We've handed it
Okay.
out here. It's public knowledge, and if when I look at the timeline, I've looked at the dates, and there's with that compression, we can move things a day or two or a week, but it gets really tight. So yeah, I don't know what other options we have.
All right, thank you so much.
You're welcome.
Supervisor Huffberger?
Thank you, Madam Chair. Matthew, assuming that the numbers from the census will change, it is probable that there will be district line changes even if we didn't change the number of supervisors. Is that correct?
That is correct.
Thank you.
Supervisor Diedrich?
Thank you, Madam Chair. Matt, we've talked about this a lot, both here at the County Board and at Administrative Services, and I don't envy the project you've got to juggle this year to get this done, but I appreciate you running with this. I would like to remind everybody, the public hearings are going to be important, if for no other reason that to educate people that the redistricting we're talking about for Calumet County supervisors is not the redistricting that becomes a political potato in the state of Wisconsin. This is something totally different. And I know we've talked about it in other meetings, but I wanted to be sure that we had that here on the public record. And secondly, Matt, I don't know if you remember, I was here when we did this 10 years ago or so, and we had a little bit of a blip up in the Appleton area when the districts were resized, clearly because of population change, but one incumbent supervisor was blocked out of the district by like 2 city blocks. So after redistricting, before the election, there were 2 supervisors residing in the new district and no supervisors residing in the quote, whatever district. And I think, if I remember correctly, we couldn't get someone to run in that district. So whatever we can do to try to avoid what I'll call a glitch or some oversight would be appreciated going forward. I know it's tough enough to meet the schedule, but anyway, just so I just have that in front of you. Thank you.
Thank you.
Okay.
I didn't mean to put it again, I'm sorry, Madam Chair.
All right,
I was trying to turn it off.
so you do not want to speak? Okay. All right, Supervisor Steer?
Thank you, Madam Chairman. One question is, I know that how we redistrict for the county. However, I know it also, the village, like of Harrison, will have some say in that, because I remember the last time they made some changes to that. So, is that still a possibility that they will change their district? Because I know they added District 6 and I'm in 7. And I had my district like cut in half. But anyway, I know they did some changing there. Also, the village themselves changed whatever.
Was it via annexation or incorporation?
No, not the incorporation. This was just, I know the original plan of the district from the county was different than the one we eventually voted on because Harrison changed some things in that plan.
Okay.
It was not the same. The final was not the same as the original.
And, from the tentative plan to the final plan, a unit of government like Harrison can request that change. And there might have been a reason, it might have been a school district line. It gets complicated because if you have a school district that splits a supervisory district, that clerk has to do 2 different ballots, or there's 2 different ballots. So a lot goes in. So they might have requested that, and the county entertained it. The units of government generally wouldn't dictate to the county board that they had to change the district map, more or less try to work within it. In the spirit of cooperation, I think the county and units of government would work together to rectify any issue. So but I'm not aware of the past, the last time. Thanks.
Okay. Supervisor Karth.
Thank you. I just want to say, I really appreciate everybody who remembers the last redistricting and the supervisor who was displaced from their district, because that was me. And I came back, right? But I had to run against Ron Green because it was District 1 and 2, and it became District, 1. And anyway, I just wanted to say, while I completely appreciate that, I want us not to lose sight of what this is for, and it's for the constituents. And I would like us to focus more on redistricting so that we meet the needs of the constituents than redistricting so not to blur those boundaries. I mean, I know what it felt like, and I remember that runoff election. It was not pleasant. But really, it's not about me, it's not about us, it's about the people we serve, and I don't want to lose sight of that. So thank you for remembering, but let's keep our focus on the people we serve.
Okay, there appears to be no more questions. So, thank you, Matt.
Thank you.
Keep tuned. All right, moving on, Resolution 2021-13.
Resolution authorizing the amendment of the 2021 budget for the award of the Coronavirus Supplemental Funding Grant introduced by the Protection of Persons and Property Committee and the Administrative Services Committee.
All right. Merlin, would you speak to that, please?
Thank you, Madam Chair. I certainly will. Our Calumet County Sheriff's Office applied for and subsequently was awarded a grant of $131,500 from the State of Wisconsin Department of Justice for the purpose of purchasing equipment for thermal imaging as well as Polycom and WebEx communication equipment. And so this resolution asks for approval of this board to for the finance director be authorized to amend our 2020 should be 21 budget, I believe, to reflect the award of the coronavirus emergency funding grant in the amount of $131,500. Thank you.
And I neglected to say that we had a motion by Supervisor Booty and second by Supervisor Schwallenberg. So we have that motion on the floor, and Supervisor Gens has explained that. Is there any questions? All right, please vote your, excuse me, Supervisor Dreheim.
Thank you. Do we have to match this, or is it just? No. Okay, good, thank you.
Supervisor Diedrich?
Thank you, Madam Chair. Just a general question. This is maybe for the administrator. This is a coronavirus supplemental funding for the Sheriff's Department. The county received a lot of coronavirus support in the last year or so. Are all those monies now, how can I rephrase? Have we requested all the monies we can? Is there any more out there we think we need to go after before this American Rescue Plan, or is this kind of the last of it?
This is separate.
That's a difficult question because that could, there could be additional funds that we would apply for, but it's separate from the Rescue Plan Act dollars. And the dollars that we have right now related to the other coronavirus funding has been primarily earmarked towards health, I believe, public health. So these are additional funds that the sheriff's office applied for.
Thank you.
Okay, if there are no other questions, please vote your ballot. We have 19 yes, 0 nay, and 2 are absent, so we have a 2/3 vote, and that resolution has been adopted. Moving on to Resolution 2021-14.
Resolution authorizing the amendment of the 2021 budget for the award of the NCHIP LiveScan implementation grant introduced by the Administrative Services Committee.
All right, I have a motion by Supervisor Booty and a second by Supervisor Draheim. And Supervisor Gens, would you speak to this resolution?
Thank you. Here again, our Sheriff's Department applied for and was awarded a grant for funding to purchase equipment to upgrade the current fingerprint equipment and provide an additional LiveScan device for fingerprinting juveniles and the general public without entering the secure area of our jail. And so again, this was awarded. The grant was in the amount of $8,471, and there was a county match here of $941 for the total $9,412. Thank you.
All right. All right. Are there any questions regarding this resolution? Seeing none, please vote your ballot. We have 19 yes, 0 nay, 2 absent. We have a 2/3 vote, so that resolution has been adopted. Moving on to Resolution 2021-15.
Resolution eliminating one full-time equivalent position of financial manager in the Department of Health and Human Services and replacing said position with one full-time equivalent accountant position effective upon adoption, introduced by the Administrative Services Committee.
All right, I have a motion by Supervisor Karth and a second by Supervisor Diedrich. And Supervisor Gens, would you speak to this resolution?
Thank you. I would be happy to. Again, the department has determined that they want to do some reorganization. They need the accountant help, and they feel that they can do the management in another fashion, and so they're requesting that the full-time equivalent position of financial manager in the Department of Health be eliminated, and that one full-time equivalent accountant position be established to more effectively deal with work that needs to be done within that department. Thank you.
All right, I have a question by Supervisor Draheim.
Can you tell me what step the financial manager was at?
You mean pay grade, Ken?
Yeah.
Pay grade? It was 11 or 12, Michelle. I just can't remember. 12?
But in the steps it says we're now at an 8.
So the accountant is a lower level position on the compensation plan. So the financial manager retired, it's eliminated, we replace it with an accountant at a lower pay grade.
So the difference is what?
In total, it would depend on where this person starts and where the financial manager retired from. So the savings is, it's not done for the savings, if that matters, but there's, it just happens to be savings attached to it.
Thank you.
All right, if there are no other questions, please vote your ballot. Supervisor Weingart, would you please confirm?
You have to actually press your vote again first and then confirm. Thank
There you go. 19 yes, 0 nay, 2 absent. We have a 2/3 vote, so that resolution has been adopted. Moving on to Resolution 2021-16.
Resolution amending the rules of order of the county board, amending rule related to virtual remote meetings, introduced by Supervisor Stoffel and Connors.
All right, I have a motion by Supervisor Woody and a second by Supervisor Baraboo. And Todd will talk about this resolution.
Thank you. I was going to have Kimberly provide some of the
Okay.
detailed information if necessary. Otherwise, you have the tracked changes. The Rules Committee had met on these proposed changes. It had been suggested by several of you that you do these sooner than later, as we're currently operating under some of these rule changes, and we no longer have the emergency order in place, which was allowing us to modify how we were doing business. So this was in an effort to make that clear that going forward that these would be the new amended rules. So if there's specific questions to those changes, we can respond to those.
Are there any questions? Supervisor Booty.
Yeah, could you just please clarify? I know you said that the Rules Committee had looked and discussed this, but I see this is not coming from the Rules Committee, so could you just explain the logistics of that?
When the Rules Committee met, they had proposed and agreed upon moving them to the next organizational meeting. Several meetings, other meetings outside of rules, board members have mentioned that they would like the changes sooner than later rather than getting the group back together. I had asked Tom and Alice if they would support the changes to provide them to you earlier. Just these changes. There are other changes, as you know, Matthew, that will come during the next organizational meeting.
Supervisor Karth.
Thank you, Madam Chair. I just want to speak to say I am on the Rules Committee, and I'm the one who brought this to the table. And the changes in here are minor and still absolutely reflect the intent. So if that helps at all, I just want that to be said.
Thank you, Supervisor Karth. Supervisor Diedrich.
Thank you, Madam Chair. Excuse me, the new paragraph 5, the red language in there talks about a board or committee member cannot be present. The chairperson may approve remote attendance, et cetera. Just makes me a little uncomfortable from the standpoint that as we're operating, I have been operating the past year in clearly unprecedented circumstances for this board, and people couldn't attend because things were locked down. People had health concerns, and I certainly appreciate that. I was obviously one of them. But this is awfully broad brushed. That's my concern. I know the 21 people on this board, and I trust them, but I just don't know if this is something that could be subject to abuse by a particular supervisor. It's just like if I decide to go on vacation, I still want to attend, well, I have a choice. I either attend and go on vacation later, or I get the chairman to say, yeah, Ron, you can call in. It just, it just seems too loose to me, too broad-brushed when you don't have a pending emergency like we've been under. Similarly, if I'm hospitalized, which could happen, should I be allowed to vote remotely on some important issue? Well, look at the Congress of the United States a couple years ago. They couldn't bring the senator from Arizona to vote. He had to physically be there. And he was suffering some severe medical issues. I'm just concerned that paragraph 5 is a little too broad in its application. That's what I'm concerned about. The rest of it, I have no problem. I think if you have an emergency meeting or a need to call a meeting, the chair wants to say, well, it's short notice, maybe we can do this remotely. I understand that kind of stuff. But the language says here, if I can't be there, the chairperson can approved me to attend remotely, given the circumstances. Well, there's no rules on the circumstances. There's no real guidelines, and I'm concerned about that language. So I'm not going to support this change as written. And unfortunately, I don't have a good alternative either. Thank you.
All right.
Was there a question that you wanted to address, or just a comment?
No, I'm just saying, I think paragraph 5 is a little too broad and subject to arbitrary approval or disapproval. There's just no guidelines. I'm sorry, Kimberly, I wish I could give you an amendment that would help me be comfortable with. I don't have one.
All right,
Sorry.
Supervisor Schwallenberg?
Thank you, Madam Chair. Am I understanding this correctly? This, even for all committee members, the board chair makes the decision, or does that committee chair decide?
It's supposed to be the committee chair if it's a committee and the board chair if it's county board.
Okay, because I'm seeing that the person can call all three, one of three people. They can either call Beth or the board chair or the committee chair to say they can't make it, right? Am I reading that correctly? I guess I would like to see, and this happens quite often, that they don't call the chair of the committee. A lot of times you find out at a committee that somebody has called in and said they can't make it.
One second. I believe the language is as you describe it, Mary, but the practice is based on the committee's practice. So if they call the department head, that's typical, that they wouldn't call the chair of the committee. In some instances, they may call the chair. I believe the language allows for that because then the department head lets the committee chair know about the absence. But Kimberly's confirming that I've got
Right,
that
because
correct.
more often than not, I've never called personally about somebody not making a meeting.
Right.
All right, we'll check that out and then we'll get right back to you. Supervisor Hashke?
Thank you, Madam Chair. I'll have to agree with Supervisor Diedrich because the word extenuating circumstances, I think the term what you're looking for is ambiguous. It's ambiguous. It is subject to interpretation. We are elected officials. There are 21 supervisors. If you can't be here, there's 20 other people. Committees are made of board members and citizen members. If you can't be there, you're absent. I know and we're hypersensitive with COVID-19, but changing the rules for this to put this kind of language in there, I think, is dangerous. And I think it leaves it, not saying anyone here, but in the future, leaves it for potential for power or abuse. So I guess the term I would use is, I think that term extenuating circumstances is too ambiguous for me to support this. Thank you.
Supervisor Karth?
Thank you again, Madam Chair. Again, because I brought this to the committee, I want to speak to some of these concerns. In Menasha, in their city council, they had a disabled individual that was unable to make some council meetings because of, was not able to get public transportation on days where things were slick. They may have been ill and not able to make the meetings. It was a big thing where Menasha said, no, if you're not here, then your vote can't count. And it made national news. And this was a few years ago, City of Menasha right here. So we live in a technological society. You look at the amount of people who during the pandemic were able to work from home virtually and be very productive. And the people who did not adapt to the new technology that we have available today were furloughed. And as a county board, we can make a choice to adapt to technology or to be left behind. That's one thing. That's one thing. Your concern about the language, though, is another. And I just want to mention to this, we are all on this board, not because we're making a whole lot of ching to be sitting in these seats. Nobody is here because it's a get-rich type of thing. And I don't think any of us are going to abuse it. We elect board chairs, we elect committee chairs that we trust. So the language reflects that they will use their best judgment, and we elected them to make and use that judgment to serve in our best interests. There have been a lot of committees where if people can't show up, they don't have quorum. So we're paying out, stipends for votes that we can't have. This would help that. Extenuating circumstances is kind of a catch-all. In my opinion, how I feel about it is I trust the people we elect to be committee chairs and to be board chairs, and the power is in them, not the board member who's not showing up for whatever reason. That's a whole nother situation, and it's the committee chair and the board chair who can take that on.
Todd has an answer to Supervisor Schwallenberg's question.
Because it was right in front of my face. The language remains the same, Mary. So in that new number 5, formerly number 3, the language had been, and continues as recommended from the rules to be the board chair, the committee chair, or the county clerk. So it's just based on past practice as to how that's handled. Similar to the agenda, the chair has the authority to take care of those matters or to designate the department as that they have in the past.
Okay. All right, so then we have Supervisor Diedrich, you're up again.
Thank you, Madam Chair. Having thought about this, and it's important that we meet as a group face-to-face, because when we are discussing topics, body language, tone of voice, eye rolling, whatever, it all comes into play. It's a human, whatever. Matthew could probably tell us what % of human communication is nonverbal. I can't, but someone can. So perhaps we could get past this concern I have by what it says here, cannot be present due to extenuating circumstances, and their non-presence would lead to lack of a quorum. That would tighten it up quite a bit. In other words, the chairperson, if to get a quorum authorizes people to attend remotely, that's a reason outside of just 1 or 2 people not showing up. So, and if you want me to try to make that a motion for amendment, I could try to do that, but we'll see what other people want to say. Thanks.
All right. Supervisor Heskey.
Thank you, Madam Chair. So I appreciate what you said. I agree with you that if there is indeed a need of a quorum. But I also want to remind everybody that we represent the people, and this is a public meeting. This is a public meeting where people can come and attend and see how we operate together as a group. Now, I worked remotely for 7 months, and trust me, and now I'm back in my office, I get more work done, there's more collaborative work, there's more face-to-face, there's more opportunity to solve problems than in your living room or on your kitchen table. The reason why that this is a public meeting and why we have set times and it's posted is so people can come in and see the people's business. And I'm sorry, I understand the circumstance that you were displaying or that you had talked about, but I truly believe you need to be here. And once this pandemic goes away, we need to get back to doing this. I think personally, with COVID-19, I think there's been a lot of angst as far as changing rules on how government operates. I don't think that's what the people want. The people want the business to be done here so that when they have the opportunity to come to a public hearing, that they can see and face their representatives as the meeting is ongoing. Thank you.
Thank you, Supervisor Heskey. Supervisor Huffberger.
Thank you, Madam Chair. I have learned quite a bit in the last couple of minutes. I thank my fellow supervisors for educating me. But I must admit, when I first saw this, I was delighted. I'm only talking about my world, my little world, and my committees. And on my committees, I really want to hear what every one of those people want to say. I would rather have that person calling remotely when there's some issue going on than to not communicate at all. You guys have taught me some things, and that's different than I had thought before, and I appreciate that. But once again, I'm just, from my world, I would rather have my people talk to me, even if it has to be on a phone when I'm having a committee meeting. Thank you.
Okay, Supervisor Schwallenberg.
Thank you, Madam Chair. First of all, I was going to say, we know that should we need a quorum, the person that makes our quorum is sitting at the head table up there. Alice always comes to make up a quorum, which doesn't happen real often. My committees, I don't believe anybody has ever abused, even with COVID, the fact that they couldn't be there. It was either, because we didn't require it, or there were health reasons for it. So I don't see anybody abusing it, and I would agree too that I'd rather have them, online. It does happen. There are circumstances at times where it does, that because those people too have an input that I like to hear also. Thank you.
All right, Supervisor Steer, or excuse me, Draheim.
Thank you, Madam Chairman. I'm from the old school, and you had to be here if you wanted to vote on anything, and that's the way it should be. Reading this over, in other words, we can have 12 people call in and say, we aren't coming to the county board meeting because, well, I want to watch the basketball game tonight. So committee chair says, well, okay, fine. You can stay home and you can watch TV while we're doing our stuff. Not good. Not good at all. Come on, folks. We went through this and we got through it okay. If it comes up as emergency again, we'll handle it. But otherwise, no. I'm going to vote against this. I'm sorry.
Supervisor Steer.
Thank you, Madam Chair. Again, like Mike says, I appreciate everything, what everyone said. It led me to think more about it. Like Ken, I believe in in-person meetings. I think there's something to be said for eye contact and all the rest of it. My other problem with it, my biggest problem is the chair or whoever may accept their excuse. What are acceptable excuses? Are we going to have a guideline? Are we going to just, oh yeah, okay, I'll let you virtual? I don't want that. No. I want it in person. Thank you.
Let me give you an example of what happened at our last county board meeting. Supervisor Hartle was at a meeting, family outing, okay? She asked if she could attend virtually. I said, yes, you may attend virtually. And as you recall, she did vote virtually, she attended the meeting virtually. So that's kind of like one example. Another example might be if a person is going under treatment for some things and just isn't capable of meeting here in person, that person certainly is allowed to attend virtually. For him to go play basketball, I certainly wouldn't approve that. So those are just a couple instances that I dealt with just lately. And I believe Supervisor Huffberger had asked the same thing, and he found it very difficult to be able to meet virtually, so he was excused. So Supervisor Steer, back to you.
Thank you, Madam Chair. I guess the point I'm trying to make is we have how many different chairs of committees? I may say no for somebody's excuse, where somebody else may say yes for the same excuse. There's a problem for me there. We have no direction as to what is acceptable. You may accept it, I may not. So there we get ourselves into a little dilemma. Thank you.
All right, are there any other questions, comments? Please vote your ballot. Supervisor, there, thank you. We have 13 yes, 6 no, 0 2 absent, 2/3 vote, so we have adopted that resolution. All right, moving on to Resolution 21-17.
Resolution amending the 2021 budget for the expenditure of American Rescue Plan Act funds, introduced by the Administrative Services Committee.
Do I have a motion? I have a motion by Supervisor Draheim and a second by Supervisor Stillman. And Supervisor Gintz, would you speak to this resolution?
Yes, I would be happy to. Under the American Rescue Plan Act, it's scheduled that Calumet County will receive $9.729 million. And so in anticipation of these dollars, the administration has looked at and considered all possibilities for possible projects that this money might be spent for. And unbelievable amount of work has been done, including input from all of the departments in our county government, as well as reaching out to the cities, the villages, the towns make up our county, and asking for input on projects that they might have that they'd like to have considered. Well, there were a total of 104 projects that initially were brought forward in this process. And after it was, each of these projects was looked at, 44 projects were deemed eligible for funding. At this point, 23 projects are recommended to be funded, and the amount that would be spent of this total 9.7 million would be $1,749,850. And so this resolution is asking that the Finance Department Director be authorized to amend our 2021 budget to reflect the expenditure of the American Rescue Plan Act funding in the amount of $1,749,850 for the 23 projects. As we continue going through the process, additional projects will be recommended for funding and be brought to this board for the approval. But right now, we're looking at 23 projects being recommended for funding and approval to adjust the 2021 budget for those 23 projects.
Right. I'm going to have Matt explain how we came to these projects. Matt, would you please explain the procedure, how you did this?
So on page 26 of your packet, there's a process summary, and I know Supervisor Gans touched on it. A little bit of background information. We did receive, or we were notified we're going to receive $9.729 million in direct aid to Calumet County. The first payment, or half of that, was received and that was $4,864,602. The second payment will be received, the second half, within a year of that first payment. So from a project review standpoint and how we received all the projects, Todd, the county administrator, had asked all the departments at a department head meeting to submit projects that they thought may be eligible within under the guidelines of ARPA. Then at a follow-up intergovernmental meeting I believe that was in mid-May, the local units there we discussed the ARPA projects and the ARPA funding, and they were asked to submit anything they may have. In addition, some of the departments that work closely with nonprofits in the community had reached out. All that came together, and on page 26, as Marla stated, 104 projects were submitted for approximately $32 million. After that, they were reviewed, and there was a team review, and that team consisted of the county administrator, corporation counsel, the finance director, and myself. And we looked at those projects as they pertain to eligible funding criteria within ARPA. There's 5 project categories. 3 were considered for this. They were responding to the COVID-19 pandemic, responding to a negative impact, economic impact of the pandemic, and necessary investments in water, sewer, and broadband. The other 2 categories included revenue loss, which we didn't think we had any, and then also there was a premium pay to essential workers. So we focused on those 3 categories. The next thing we did, we reviewed some county criteria, which included accountability and outreach. On page 27 of your packet, you'll see financial stewardship, timeliness, a countywide approach, leverage, projects with a long-term impact, and compliance. So once we reviewed those, all the projects from the ARPA, the county criteria and the ARPA eligibility criteria, there were 44 projects deemed eligible for $11,551,250. Keep in mind, these projects, the project list changed daily. So things were added, costs got adjusted on different projects and different components of projects. So sometimes twice a day. All this information was gathered and put together and monitored and updated as needed. Again, we did a team review for projects that were time sensitive from a planning perspective. Letting them out now would allow proper planning, as they might have been interrelated to another project, or they're ready to implement. So those projects totaled, there were 23 projects for $1,789,850, which are included in the resolution, which is page 25 of your packet. So you'll see a listing of those projects in the resolution. The remaining ARPA funds of $7,939,751, there's remains within for remaining projects. The remaining projects on the list that were deemed that they would be eligible need to be refined in scope. There's more information. Some of the large projects out there that maybe a grant project for tourism-related projects, but that scope needs to be defined and costs need to be defined before that can be reviewed further. Lastly, if you look at page 28, that pie chart just gives you an idea. Within the funding criteria within ARPA, there are 5 funding categories. There are 66 subcategories within ARPA. And then those can be looped into maybe a dozen categories, subcategories, and further subcategories. So when we look at that pie chart, you'll see the largest eligible projects, the largest pool of eligible projects are broadband projects. There's a lot of money there for broadband. We are currently working to find the appropriate solution. And that solution is Not how do we get a middle mile, how do we put in infrastructure, how do we get that to residents' homes? That's, I think, our concern as county staff. We want to make sure that that service and that infrastructure gets into a home of a county resident that's served or underserved or unserved. The second largest category is investment to public facilities that respond to the pandemic. A lot of those projects we realized during the pandemic, there were issues, and some money would be used to mitigate those issues. So you can look at the different funding categories. We have aid to tourism, travel, household assistance, small business assistance, small stormwater conservation and non-point vaccination. So a whole multitude of funding categories within ARPA. That's the process on how, the process summary on how you get to the resolution today.
All right. I have a question by Supervisor Booty.
Thank you very much. Matt, could you please remind me and just educate everyone here, when do these funds need to be expended in full by?
The funds need to be obligated by December 1st of 2024. Obligated, contracted, contractually obligated, or committed. They need to be expended, or the expenditures need to happen by December 31st of 2026.
Okay, so we have plenty of time to refine the scope of any projects, to bring in new projects that these funds are applicable for. And so we don't need to worry about wrapping this all up in our next 1 or 2 budget cycles. We've got much more time.
There is, when you consider it in that context, at the end of 2026, we do have time. There's no need to rush.
Okay, thank you.
Supervisor Gleckner.
Thank you, Madam Chairman. If you refer to the pie chart, in the upper part of the circle, there's a dark green piece of pie, and it has a line coming off of it, but no identification of what that percentage is or what it's for. Can you shed some light on that?
I will look into that, Ed, and I'll have to get back to you.
Okay. No problem.
Okay.
I have another question. In the previous box, we are looking at the economic development. There was only one economic development project. It didn't make the first cut here because it's still being considered. Is that correct?
Yeah, I had a very good discussion with Mary about that and about the economic development component. And yeah, that scope needs to be refined and defined more before it can be further reviewed.
Do you have any concept of what the dollar amount was for that proposed project?
$500,000.
$500,000. Thank you.
Supervisor Stillman.
Thank you. All these projects on page 26 and 27, are they all for Calumet County then?
The listing on page 25?
Okay, start out page 26. Okay, I'm going, okay, it starts out like 104 projects, okay. Okay, there's the information technology for 7 projects. Okay, like you go down to the next page, there's 44 projects deemed eligible. There's information technology 5. Okay, then you go down to the next one, 23 projects, information technology 4. Is that all for Calumet County then, or what? Okay, okay, why does, it seems like information technology, they keep changing everything. I don't know, have they got too many people in IT that have to come up with changing something to justify their jobs? You know, every time you get on a computer or something like that has changed. You know, there's no saying KISS, keep it simple, stupid. You know, I mean, I I mean, maybe I'm too old, I can't keep up with stuff, but I think with the last thing, we got like an Ag and Extension meeting come out, how to come up, and they came up with it was called Doodle. Well, holy mackerel, I never heard of that one either. You know, I mean, why do they keep coming up with stuff like I say, KISS, keep it simple, stupid, and we can all get by, I would think, but, I mean, maybe the younger people can get onto this quicker than I can, but I'm kind of losing the boat, I guess, or something, so, okay, thank you.
Maybe can I make a comment? You know, we discussed this at the Administrative Services Committee too. And this is a whole process. I think, you know, the American Rescue Plan Act funds determined that, you know, Calumet County will receive $9.7 million totally over some time period. And so, and they gave us some information in terms of what the criteria for how these funds could be spent. And these funds could be spent for items that we didn't have originally in our budget. And so in determining what kinds of work could be possibly done with that $9.7 million, Todd and Matt and Kimberly, from a legal perspective, determined that what we would do is we'd get all the department heads together and we'd ask them for recommendations on projects that this money could be assigned to. And also, to reach out even further, we sent out some information to our cities and our villages and our towns, asking for, do they have any recommendations in terms of what projects that this $9.7 million could be spent for. And so that's how out of that came 104 project possibilities that this money could be spent for. And then we had to take a look through Todd and Matt and Kimberly and department heads. We had to look at which of these projects, which of these 104 projects would be deemed eligible, given the criteria that the federal government gave us in the spending of those dollars. And out of that 104 projects, 44 were deemed eligible for funding. And now there's a process of further refining that whole group of projects. And this resolution says there's a recommendation for 23 of those projects to go ahead and be funded now. And they total $1,749,850. So there's a whole lot of money that still needs to be determined as to where it's going to go, which project it's going to go to. And so I don't, you know, there's nothing fishy being done here. It's a process, and we've got to, you know, the process calls for us to put some faith into those that are part of the group that are conducting the process.
Okay, Supervisor Draheim, you had a question?
Yes, on Appendix A on page 25, administration, who got the red shoes? What is that?
It's public relations that she operates the multicultural group for vaccination.
And it's called Red Shoes. Okay, Todd, do you want to clarify anything?
Well, just one clarifying point, that some of the items you see on this list may be familiar because they are budgeted. So for example, the water and sewer upgrade that's identified on here from maintenance is actually taking place right now. It's in your budget for this year out of sales tax. So there are projects that are on this list that are currently budgeted, but that we are replacing with rescue plan dollars versus either sales tax or tax levy. So those were just a few of the items that we knew we could prioritize on here and replace those projects with ARPA dollars. I just wanted to be clear on that because we didn't specify that on here. Mental health care services, for example, from the sheriff is in the existing budget, but it's tax levy and it was allowable, so we included it.
Okay, if there are no other questions then, please vote your ballot. We have 19 yes, 0 nay, 2 absent. It has a 2/3 vote, so that resolution has been adopted. All right, moving on to supervisor reports. Anybody been anywhere that they have anything to report? Supervisor Schwallenberg?
Thank you, Madam Chair. Geez, we must all be talked out. So I'm going to talk a little more. I apologize ahead of time. I'd like to thank Madam Chairman for allowing me to attend the NACO conference virtually. It ran from Thursday to Monday. It's quite a lengthy conference. There are 3,000 counties in the United States, and almost 2,500 counties belong to this organization. They had wanted to reach the 2,500 number, but were just a little bit short of that. If you want to listen to some of the featured speakers, if you go on NACO's sites, you can. They're listed. You can pick up their speeches. A lot of them are political, but that happens no matter which party is in office. They are asked to come to this conference, and they've had members from both parties there too. As you all know, in Wisconsin, we are nonpartisan, but that is not the case through the rest of the country. Not every county board is nonpartisan. I serve on the Human Services and Education Committee, Steering Committee. Why they combined those two, I have no idea. We sent 15 resolutions to the full board. Of those, only 2 of them related to education. One was asking for full federal funding to teach civics in our schools, and the other was to promote arts and cultures in counties. There were 3 cross-references, cross-jurisdictional resolutions. One addressing toxic exposure for our veterans. And related to this, I don't know if everybody knows, there's a county board member, Tom Schneider, from Winnebago County. He has been appointed chair of the Veterans Steering Committee. The other one was to support federal solutions to the homework gap that occurred during COVID. And the third was to support a permanent federal broadband assistant program. There are several sessions, like any conference that you can go to. One of them is the Rural Action Caucus. If you're not aware, there's a TV star called Mariska Hargitay. She's president of an organization called Joyful Hearts, which is working to eliminate the backlog of rape kit cases that are outstanding in the country, several of them which are many, many years old. They have also produced a documentary that is called I Am Evidence, which I haven't seen it, but which they claim is very good if we can see it sometime. That, like I said, that was a very full conference. Mark O'Connell, the WCA executive director, was on one of the sessions talking about dark stores, along with a county board member from Oklahoma. Their tax rate is 49th in the country, whereas ours is a little up towards the top. Related to health and human services, There's a multimedia vaccine campaign called Our Doctors. If you have seen either in the Tri-County or the Brilliant News or on TV or the radio, a doctor called Dr. Sharon Rink. She lives in our county, and she is the doctor that serves on our Health and Human Services Committee, and she has done this public service announcement. She's a pediatrician that works for Theta Care. Kimberly and our child welfare supervisor Chu Li Yang presented on the child welfare collaboration team, which was very informative. We're waiting for the judge's opinion on this at some time if you want to hear about child welfare and CHIPS. We used to contract, I believe, with an attorney to do this, and because of Kimberly's experience with Guardian Ad Litem and the CHIPS program, she is now in charge of this instead of us contracting with another lawyer. Bonnie's presentation, she didn't refer too much to COVID. I thought she was going to do a little more. We had a clinic in Chilton this last Saturday at Lapito's restaurant, which is by Farm and Home. We have had issues with clinics not serving people with allergies because you had to either have an ambulance on site, which there was at this clinic, and the National Guard did the administration of the vaccine. I just spoke to Bonnie. She said they were very pleased with the outcome that they had at this clinic, serving the Hispanic population. It was promoted to that population. We now have a clinic a traveling clinic that comes in twice a week, I believe. And I think Bonnie said at our last meeting that our 2 days in our county had the most participation over the other two counties, Winnebago, I think, Outagamie or whatever. So, parks. I would like to thank property owner to the north of Calumet County for offering his property to the county for purchase. If you've seen our agenda, there was a talk of us looking at property. It's a wonderful piece of property, but the commission determined not to purchase it due to the purchase price and an informal policy we have that we do not compete with local businesses, which this property would have done should we have purchased it, plus the fact that we at the present time do not have the personnel to handle. It was a large piece of property. Brothertown Harbor, our stream that runs into the harbor, needs some stabilization done. We're not the only property owners on that stream, so that's going to be a little bit of a, well, we're going to do what we can, I guess. We're continuing to work on the problems with the building at Ledgeview, whether we'll repair, add on, or replace. We haven't determined yet. At the present time, the commission decided to close the Tube Hill, which means it will be open to the public, but only use at your own risk. Some of those issues we've had is because Mother Nature doesn't always cooperate. We don't always have the staff because it's usually kids or whatever, our younger personnel to handle those duties. So, and the fact that our equipment is in the need of replacement too. So this is at the present time, and maybe revisited in the future. Our caves are now open at Ledgeview, but with some restrictions, the size of our groups are smaller, and you have to wear a mask when you go into the cave. If you've noticed, one of the things that's on the ARP funding is for ventilation in the caves. That's one of the issues that we have too. That was a recommendation from health that if we could, for the state to increase the ventilation in the caves. They come in with large groups, so our staff will do some education above ground to take up time and spend less time in the caves. I believe that's all. Sorry for the lengthy time. Thank you.
Thank you, Supervisor Schwalenberg. Supervisor Karth.
Thank you. I listened to a conference on strategic trends and implications of new technology in local government. And after tonight's discussion, I think I was contemplating not bringing this up because of time and because it's late, but I think it's so timely based on our discussion today. Henry Ford said, if I had asked people what they wanted, they would have asked for faster horses. But we all drove our cars here today. So what we learned, and it's so true, technology advancements are here and they're only going to increase. And they have destabilized economies across the globe when they weren't ready for them. So think about 25 years ago, Katie Couric asked, what is the internet? 25 years ago, and now it's such a part of our lives. Such a part of our lives, we had to have a lengthy discussion tonight on how we were using it to increase participation in these meetings. We need to be aware as a county, as a county board, as county staff about technology shifts, or in Calumet County, we will be left behind. So speaking about the IT projects and keeping things simple, we really need to change our mindset a little bit and realize that we need to keep up. If we want to retain and attract talent to Calumet County, we have to be a place where people can come to work. Some of the technology shifts are autonomous vehicles. People are, they will be transporting our goods. They will be providing items in our supply chain. They will be used for public transit, and we need to be ready. Drones, an issue of airspace and privacy, and I'm sure the police department has to deal with questions on those all the time. There was a woman in Los Angeles who called the police because her neighbor had a drone and it was looking in her window, and the police said, there's nothing illegal about that unless you can prove that they were taking pictures. So the onus was on the woman whose drone was looking in her window to prove that her neighbor was taking pictures of her in her bedroom window. We need to do better. Expansion of consumer-to-consumer economies, right? You're like, what is a consumer-to-consumer economy? Grubhub, Uber, Airbnb, they're here, and they're not going to go anywhere. And if we knew how to better maximize on that, maybe we can utilize those to help provide transportation of our aging population to medical appointments or to get food to those who need it. So there are things that as a county we should be looking into that are already here. Automated vehicles and parking fees. It's a minor thing, but how do we handle that? Electric vehicles, gas stations are declining. There are less, unless it's a quick trip and you're going to buy your bread and bananas. There are less gas stations now than there were 10 years ago, and it's only going to get worse. Artificial intelligence. 40% of our jobs in the U.S. are susceptible to computerization within the next 20 years. If we aren't prepared as a county for that, we will be left behind. I love that our county is rural and charming, and I want to keep it rural and charming, but that doesn't mean that we need to stay left behind. Peer-to-peer networks. You're like, what is a peer-to-peer network, and why is this important? Peer-to-peer networks are here, and in some of those IT projects, we could utilize some of those. We were having that discussion earlier. A peer-to-peer network is when you share data from one peer network to another. Some peer-to-peer networks that you might be familiar with are, Napster a long time ago was a peer-to-peer network, but more commonly, Netflix, Amazon Prime. Those are peer-to-peer networks, and we can utilize that in our county. We can utilize that technology to pass data and to make the services that we provide to our constituents easier, cheaper, safer. So if we want to be on the forefront of economic development, I just want to encourage you guys, both on the board and, and in the county divisions, that we really need to, I would love to see if we had a committee that was looking for the future, not trying to maintain the status quo. And I know you do on so many levels. But I do believe we're almost at a tipping point where we may be left behind. The Internet of Things, right? Apple Watches, your GPS systems, Fitbits, collecting all kinds of data that we could utilize. Income inequality, plays into this. We need to retain and attract talent. And you know what? People in Harrison are making really good salaries, and they have access to internet, and their children have access to internet. But there are places in this county where children do not have access to internet to do their homework. And those children are going to be left behind in terms of the skills that are going to be needed to live in the world that we are moving into and that we arguably are in right now. So we value our local economy, and we need to do better. We need to do better in this area, and that's all I'm going to say. Thank you.
Thank you, Supervisor Carth. Supervisor Booty.
Thank you. The East Central ITBEC Board had met last Wednesday, July 14th. Our collaborative Discover Wisconsin program filming has finished, and that is now in production. There was discussion regarding rail service. Part of the Canadian national system is going to be sold off to a new railway, which will be operating lines from Wausau, Prentice, Newberry, Appleton, and Green Bay. That is all. Thank you.
Thank you, Supervisor Booty. Supervisor Steer.
I see that Todd has it in his report. I was just going to talk about the open house for the jail, so never mind.
Okay. You have the county administrator's report. Are there any questions regarding his report? All right, if not, our next regular meeting date, I will need a motion to suspend the rules to hold our August meeting on August 24th instead of August 17th due to the redistricting timeline. I have a motion by Supervisor Hatchick and a second by Supervisor Baraboo. Are there any questions regarding that? All right, please vote. Supervisor Booty.
Just to clarify, that would also be at 7 p.m.?
That's
on a
correct.
different date.
All right, please vote your ballot. Nineteen yes, 0 nay, 2 absent. We have a 2/3 vote, so our next meeting will be August 24th at 7 o'clock. And there being no other business to come before the board, I would have it adjourned. Thank you very much for your attention.